November is Epilepsy Awareness Month. The CDC says nationwide, roughly 3.4 million people have this condition. Now, this includes both adults and children, so it's important to be aware of the many treatment options available for those who need it. So joining me right now is Dr. William Tatum with Mayo Clinic, and he's going to discuss everything about epilepsy. So good morning, Dr. Tatum. Thank you so much for joining us.
Good morning, Brianna. Thanks for having me.
So tell me, what is epilepsy and who does it affect?
Okay, so epilepsy is a very common condition. It's one of the most common neurological diseases that a neurologist or an epileptologist will encounter. And it can affect everyone, not just a specific faction of individuals across population, but everyone. You may remember from this morning at Astro World, there was somebody that was trampled and then had a seizure, and it was the seizure that called that attention to the individual that was otherwise being traumatized greatly.
So we often tie seizures with epilepsy, but are all seizures tied to epilepsy? Is that true?
No, it's not true. Because here, if you think about what causes a seizure, it's only a symptom that is generated by the brain. And so somebody that may have diabetes or a substance abuse issue or some other type of transient involvement of the brain may have a provoked seizure, but not necessarily have an unprovoked seizure that we call epilepsy. So not all seizures are epilepsy, but all patients with epilepsy have seizures, if that makes sense.
So what should someone do if they do see someone having a seizure? How do you assist with that?
So the first thing to do is not to panic, and then make sure that the individual is supported, that they're moved away from objects that might be damaging, that they are able to breathe on their own, that they're moving about and seeming to come around from the seizure. Now, immediately, if somebody comes on an individual with a seizure, the best thing to do is just make sure that there's no tight-fitting clothing like my tie around my purple shirt, the color of epilepsy. Make sure that they're able to breathe. Make sure that they're coming around. Turn them on their side so they won't aspirate or have drool pool in the back of their throat and cause choking or coughing noises. And in the vast majority of cases, individuals will come around and start to recover to their original baseline.
And let's talk new treatments and care. What are some treatments that you recommend for people, struggling with epilepsy?
So that's a great question, and thank you for that. As I always tell my patients, this is a great time to have epilepsy. And the reason I say that, even though epilepsy is a terrible disease to have, we have many, many new treatments. And we essentially have four different modalities. We have medication, and we have a surplus of new medications that are going to be entering the marketplace for individuals if they've not responded in the past. We have special diets that can be administered under the guidances of registered dietitians. We have a big thrust towards epilepsy surgery, trying to remove an epileptic focus from the brain itself through neurosurgery. And then we have forms of neurostimulation or neuromodulation, where we actually use electricity to so-called fight fire with fire, much the same way that the cardiologists use the defibrillator that many people are aware of from seeing that on TV to shock the heart back into its normal rhythm. We use the same thing relative to the brain.
Wow, thank you so much, Dr. Tatum. I learned so much this morning, so I can only imagine people at home have learned so much. So thank you again for joining us.